Good morning. I am Brian Johnson, CEO of Equality Illinois, the state's civil rights organization for LGBTQ people. My pronouns are he, him, his. Thank you all for joining us today. In Illinois, we have come so far and made tremendous progress regarding the inclusion, equality, and fair treatment of LGBTQ people and people living with and at risk of HIV. But we also cannot ignore what is happening in states across the country. States like Texas, where the governor is ruthlessly targeting trans kids by directing the state's child welfare agency to treat the affirming and accepted medical care of trans youth as child abuse. States like Florida, where anti-equality legislators and Governor Ron DeSantis are eager to censor all LGBTQ inclusive content in schools, content which we know can save the lives of queer youth by showing them that people just like them have existed and made wonderful contributions to our society. The stakes couldn't be higher. These struggles are life and death for LGBTQ youth. Today, we stand in solidarity with the LGBTQ communities of Texas and Florida, and organizations like Equality Texas and Equality Florida, in their struggles to build states that affirm LGBTQ youth, and as they work to turn back these vile efforts to hurt trans youth and queer families. Because of what's happening in other states, Illinois must keep moving forward to ensure affirming healthcare providers, to increase access to equitable healthcare, to get to zero new HIV infections, to build a more affirming Illinois for trans people, to support our LGBTQ older adults whose resilience and bravery built the world we live in today. This morning, you'll hear from LGBTQ advocates from across the state about what's at stake and how we can build a better Illinois in 2022. Together, we are calling on the Illinois General Assembly to take action on a suite of legislative initiatives this year to keep Illinois moving forward and to show the Midwest and the country what a thriving, inclusive, and affirming state looks like. We will not stop until we are all equal. Now, I am proud to introduce my colleague and friend, Kim Hunt, the Executive Director of the Pride Action Tank, a project of the AIDS Foundation of Chicago.
Thank you so much, Brian, and thank you, Equality Illinois, for organizing today's press conference, and good morning, everyone. As Brian said, I'm Kim Hunt, pronoun she, her. I'm with the Executive Director of Pride Action Tank, project of AIDS Foundation Chicago, where I also serve as the Senior Director of Policy and Advocacy Operations. In this very busy legislative short session, I this morning am attempting to fill the shoes of my colleague, Timothy S. Jackson, Director of Government Relations at AFC, so that he can fulfill another commitment. So this morning, I'm going to talk about two of AFC's policy priorities, HB 4264, the Getting to Zero Omnibus Bill, and HB 4430, increasing access to PrEP and PEP, as well as ways that folks can get involved to pass these and other AFC legislative priorities. Getting to Zero Illinois is a statewide community-led initiative dedicated to ending the HIV epidemic by 2030. And we will do this through increasing access to and uptake of PrEP, also called pre-exposure prophylaxis, for prevention, retaining more people living with HIV in care, and continued funding of ongoing supportive services and programs. HB 4264, the Gtz Illinois Omnibus Bill, would appropriate $15 million from the state's allocation of ARPA funds to implement GTZ Illinois, and that's American Rescue Plan Act. Funding would invest in access to PrEP and PEP, housing and support services, and an at-home HIV testing kit program, among many other items. So why is this important? For more than 4 decades, HIV and AIDS has ravaged communities across America and Illinois, with access to healthcare, HIV treatment, addressing HIV-related stigma, and access to PrEP persisting as barriers to lowering HIV incidence rates. At the end of 2019, it is estimated that nearly 42,000 Illinoisans were living with HIV. And although progress has been made over the years in reducing HIV transmissions, health disparities among historically marginalized communities persist. Ending the HIV epidemic in Illinois is a key health equity and racial justice issue. The Gtz Omnibus Bill is a strategic $15 million investment in critical services and treatment. The bill, I'm proud to say, is making its way through the House under the leadership of Leader Greg Harris. And there will be a subject matter hearing scheduled in the House Appropriations Human Services Committee in March, and we'll keep folks updated on that. The second and final bill that I'll talk about is HB 4430, increasing access to PrEP and PEP. And here our chief sponsor is Representative Kelly Cassidy. PrEP and PEP are highly effective prevention methods for reducing the risk of acquiring HIV. But even with these extremely successful prevention options, Black and Latinx communities continue to fall behind in PrEP awareness, uptake, and adherence due to several factors, including stigma, LGBTQ plus discrimination, systemic racism, medical mistrust, lack of access to healthcare, and affordability. And if current PrEP uptake numbers persist, we will continue to see the devastating impacts of HIV on these communities. In order to end the HIV epidemic in Illinois, we must take bold, creative action. HB 4430 would allow pharmacists to administer and dispense PrEP and PEP without a prescription from a provider. This is a community-centered approach, as pharmacies are found in almost every community, many with expanded hours. This is also an approach that can help reduce stigma, as pharmacists are often more approachable for people who are less inclined to go into an HIV or STI clinic. This legislation was voted out of the House Health Care Licenses Committee 2 weeks ago, and we will be filing an amendment this week that will add the Illinois Medical Society and others as supporters to the legislation. So how can people get involved with these 2 pieces of legislation moving forward and in other priorities? Earlier, I mentioned that there were things that people could do. They include always contacting your Illinois House and Senate members to express your support of these 2 bills and others. You can also join us tonight at 5:30 for the GTZ Omnibus Town Hall. My colleagues and our panel will talk in greater detail about the bill and its impact. And we also have AFC's Advocacy Day on March 9th, and we'll be hosting a legislative breakfast and other opportunities for advocacy. For both those events, folks can get registered at our Action Center on AFC's website. And with that, I'm going to turn it over to someone who I continuously make good trouble with, Mike Ziri at Equality Illinois.
Awesome. Thank you so much, Kim. Thanks so much for everything AFC is doing. Hello, everyone. My name is Mike Ziri. I'm the Director of Public Policy at Equality Illinois. My pronouns are he, him, his. And as we think about what's happening in Texas and Florida, I just saw over the weekend, Georgia was passing an anti-trans student bill. I believe Missouri has a similar bill. Across the country, these states. We also have to recognize that Illinois is not immune from these anti-LGBTQ bills being introduced here. There are state legislators right now in the General Assembly who would quickly and eagerly pass legislation to strip away the rights of LGBTQ people, to deny LGBTQ youth representation in schools, and who would take away critical health care from trans people. And we know this because just a few years ago, an Illinois state representative introduced a bill to punish doctors who provided affirming medical care to trans youth. A bill that in effect would have stripped trans youth of that critical health care. Now, because we fought back with our pro-equality majorities in the General Assembly, and because we engaged our amazing LGBTQ and allied stakeholders across Illinois, those anti-LGBTQ bills don't pass here. But we must be vigilant. And as Brian said, as Kim said, we must keep moving forward. And that means passing strong, robust legislation that helps Illinois stay a beacon of inclusion for the Midwest and the country. And so I want to highlight two bills that we're working on. And as Kim said, we caused good trouble together on both of these two bills I'm going to mention. The first is House Bill 4654. And this is a bill that would require that cultural competency be part of continuing medical education for healthcare professionals. And it's put forth by a coalition of organizations. And it's sponsored by State Representative Dagmara Avelar and State Senator Ram Vilivalam. And so I'm going to tell a short story. A few years ago, and I know Brian remembers this story as well, he and I were in Carbondale, and a trans young person told us how they would access medical care. This young person would travel 5 hours one way for a primary care visit to Howard Brown Health on the north side of Chicago just to see an affirming doctor. Because in this young person's experience, there were no providers where they lived in Carbondale or Southern Illinois who could support and provide the care this youth needed. That's both heartbreaking and frankly outrageous in the 21st century. And so LGBTQ Illinoisans, though, are not the only community that experiences these outcomes in the healthcare system. People with disabilities, people of color, people living with HIV, intersex people experience these poor outcomes, discrimination, and isolation in the healthcare system. And so an important step is to ensure healthcare providers are educated with cultural competency and cultural humility as part of their continuing medical education. This is already required in several other states, and our coalition believes that Illinois should make this part of the continuing medical education program as well. And the second bill I'm really excited about is Senate Bill 3490, and it's a bill to disrupt disparities for LGBTQ older adults and older adults living with HIV. And it's sponsored by State Senator Carina, who is with us today, and State Representative Lakeisha Collins. The bill is the initiative of a great coalition that I love working with: AARP of Illinois, AIDS Foundation Chicago, Pride Action Tank, SAGE, many partners across the state. And this bill creates a 3-year commission on LGBTQ aging, establishes an LGBTQ older adult advocate at the Illinois Department on Aging, and requires that providers that are funded by or contract with the Department on Aging in Illinois to undergo and complete LGBTQ older adult awareness and competency training. Now, these components are essential because LGBTQ people and people living with HIV face unique challenges as they age because of their sexual orientation and their gender identity, because of a lack of affirming resources, affirming services, because of social isolation, because of stigma. And SB 3490 will establish Illinois as a leader in advancing equity and affirming care for LGBTQ older adults and older adults living with HIV. And I'm really excited to say, thanks to the leadership of Senator Villa, this bill passed the Illinois Senate last week with bipartisan support. So really excited for the victory in the Senate, and looking forward to working with our champion, Representative Collins, in the House. But this work isn't just being done by Equality Illinois. It's not just being done by Pride Action Tank and AIDS Foundation Chicago. In Illinois, the work to pass these bills and to keep building the House of Equality and Inclusion here in Illinois, it's a statewide effort. And so I'm pleased now to turn the program over to two of our statewide network champions, Dave Bentlin of the Prairie Pride Coalition in Bloomington Normal, and Carrie Vine of the Rainbow Cafe LGBTQ Center in Carbondale. And first.
Great, thank you, Mike. As our state's LGBTQ plus civil rights organization, Equality Illinois has always assembled a robust legislative agenda, but this year's priorities include a bill that speaks directly to me as a member of our state's aging LGBTQ plus population. That bill, Disrupting Disparities for LGBTQ Older Adults, would begin to address some of the challenges that face older people in my community. You see, members of the LGBTQ plus population oftentimes face daunting obstacles as we enter our senior years. Many of us, particularly those who are living with AIDS and those in our transgender community, have unique healthcare concerns that require medical professionals who are educated in and culturally sensitive to these needs. This bill would begin to establish a blueprint and lay groundwork for comprehensive and culturally sensitive healthcare, not just in Chicagoland, but from Rockford to Cairo and from Quincy to Danville. In a broader sense, the lives of aging LGBTQ+ adults possess a dynamic that can often present additional uncertainties and instabilities. In many cases, we are single, live alone, are childless, and economically disadvantaged. Plus, it is not unusual for us to shoulder additional responsibilities, both economic and emotional, as we strive to care for parents and other elderly family members. Members of our LGBTQ+ older adult community do their best to enjoy their senior years, but these realities and uncertainties lead to questions. Who will advocate for us? Will the healthcare industry, social service agencies, and other services we need as we grow older treat us with respect and dignity? Can we be assured that we will live our golden years in safety and security? This bill, Senate Bill 3490, and its counterpart, House Bill 4656, would establish an LGBTQ older adult advocate within the Illinois Department on Aging to begin to incorporate policies and procedures that address these questions. The legislation has bipartisan support, including my senator, Senator Jason Barrickman, and additional support from AARP of Illinois, Equality Illinois, and SAGE, the national organization that advocates on behalf of the LGBTQ+ elder community. Some might view this legislation as promoting a special interest, but I would respond that all of us have family members, friends, loved ones, and coworkers who are LGBTQ+. I would argue that their welfare is of paramount importance to a wide cross-section of our state's population who wish to see equitable, fair treatment of everyone who seeks to have a happy, meaningful life as they grow older. I thank Equality Illinois for its unwavering support for all sectors of our LGBTQ+ community. Representative Collins and Senator Villa, chief sponsors of this legislation, and elected officials in the Senate who voted for this bill. I urge members of the Illinois House to carefully weigh the merits of this legislation and vote it into law. Thank you. And I will pass it over to Carrie Vine.
Thank you so much, Dave. As Dave said, my name is Carrie Vine. Thank you so much for having me here today. My pronouns are she, her, hers, and I am the community relations person and the vice chair for the Rainbow Cafe LGBTQ Center down here in Carbondale, Illinois. We're closer to Kentucky and Tennessee than Chicago, so it's really cool to be here today. I'm grateful also to sit as the chair for the Equality Illinois Statewide Network Group of Southern Illinois. Otherwise known, we call it as SASSY, which is Social Action of Southern Illinois. Through our local group, SASSY, we are able to connect and network with other LGBTQ people here in Southern Illinois and also gain traction within our community about current LGBTQ issues. We have been linked in with Equality Illinois with their help with downstate groups, and we've stayed knowledgeable of the current legislature in the state of Illinois about what bills are possibly coming and what will directly affect our community. Mike has really been great about coming down and helping us keep, really afoot about what's happening. And the relationship we've had with Equality Illinois is invaluable, as it seems to keep the state of Illinois just a little smaller for us. We've also had a few issues with some of our local schools down here in regard to bullying and restroom use and bad notes. I mean, it's been really hard to deal with, and thankfully, we've been so grateful for the incredible assistance from Equality Illinois and the expertise that we've been given over the past few months. Their support and strength in these issues make it more maneuverable for us as leaders in the community when dealing with these tough subjects. Through the statewide network, we have built relationships with other LGBTQ organizations all over Illinois. We have been able to form specialized groups like our elders group, Gtz, Golden Rainbows of Illinois South. And we've been able to build better resources for our community members. And what my hope with our statewide network is we continue to grow and build strength within our community for the whole state. And we'll build strength within the LGBTQ community in the Southern Illinois, and we continue to flourish and grow. And now Moni will introduce our legislators.
Hello, everybody. Moni Ruiz Velasco. I'm the Deputy Director at Equality Illinois, and my pronouns are she, her. And it is really my pleasure this morning to introduce our two legislative champions who are here with us today. So I'll start with State Representative of the 13th District and Majority Leader, Greg Harris. He's been a member of the General Assembly since 2006. He was the first openly gay person to serve in leadership at the state capitol. And Leader Harris is a longtime champion for LGBTQ rights. And we're so lucky in Illinois to have someone like him, like Leader Harris, and are so proud to have him here today. State Senator for the 25th District, Carina Villa. Senator Villa is the first Latina to serve in the 25th District. She's a social worker and a longtime champion of older adults. She's also our sponsor for Disrupting Disparities for LGBTQ Older Adults Bill, and we are so grateful for her leadership and her allyship. So please join me in welcoming Leader Harris and Senator Villa. And Leader Harris, if you could take the microphone first. Thank you.
Great, and thank you. Again, my name is Greg Harris. My pronouns are he, him, his. And I'm just really proud to be here today with all these fierce advocates from across our state, from every corner of Illinois, to fight to advance Illinois, to fight to protect our families, to fight to reduce discrimination, to fight to address disparities in healthcare, and to fight to increase access to life-saving care and affirming care. Illinois has been a beacon of hope for so many across this country, and that hasn't happened by accident. It has happened year in, year out by people doing hard work in every corner of the state to make sure that the legislature passes protection, the governor signs them in the law to guarantee basic health care and basic rights for every Illinois citizen. It's only because we fight every year, we educate, we mobilize, and we advocate, and we can't let up. We have to focus on making sure that these issues continue, because there are people right now who are still fighting to roll back the clock and to take away these protections. They're in our legislature, and they are working, as they are in every other state, to roll these things back and take us back to a darker time. Also, more than ever, it's important to act at the state level, because now we're seeing the protections we thought we had for many, many years, for decades, that were guaranteed by the precedents in the Supreme Court of the United States. All those are at risk, and the Supreme Court may roll back and take away rights which we thought we had been guaranteed. So we're here today to certainly work for LGBTQ families, but we're also here today to work in solidarity and coalition to protect reproductive rights, to protect our immigrant and refugee neighbors, to protect the environment, to protect people's right to organize, and to fight racism in all of its forms. We're here to build a better future, and we're here to be sure that we are not turning the clock back in Illinois, that we keep moving forward. So thanks.
Senator Villa.
Thank you so much. My name is Carina Villa, State Senator of the 25th District, pronouns she, her, hers. I am so thrilled and excited to be here with all of you today to talk about this very important topic. I want to go back to last year briefly and talk about a piece of legislation that I sponsored. It was HB 156. That bill ensured that we had menstrual products in all of the bathrooms in our public schools from 4th grade on up. The reason that I want to bring this up is because I want to talk about the wide gamut of protections that we're making sure happen here in the state of Illinois, not just for one one generation, but for all generations, for all of the generations of LGBTQ plus individuals living in our state. This bill, to me, was so critical because we know that students who identify as transgender have such a difficult time socially and emotionally. We know that it takes such bravery for them to be able to identify which bathroom they want to use. And if at some point they need a menstrual product, they should be able to use it. They should be able to have it accessible to them. And that was why I was so excited to pass that piece of legislation. And now, as a result of that, hopefully a youth that is in the bathroom and needs a product at least sees it and says, this is okay. There was legislators who said that it's okay for me to be who I am. I know that I have an ally somewhere in the state of Illinois. They might not know our names, right? But they know that there was someone there who said that they were important, that they mattered. And so from that early time in 4th grade, when those children are going to the bathroom and see these products, all the way on now to the bill that I'm working on to get passed now in the House, because we passed it in the Senate. We are now looking at the other end of the spectrum, of the age spectrum, right? And that is Senate Bill 3490 that did receive bipartisan support, because we know that these issues are so critical. All of us are heading to be seniors. All of us are heading in that direction. And all of us should have the opportunity to live and thrive and be who we are. And that is why I cannot wait until this bill crosses the finish line in the House and then eventually gets signed by the governor, because here in the state of Illinois, everyone should have the opportunity to live and thrive, from people who are undocumented to people who are LGBTQ plus, to all races and religions. That is who we are in the state of Illinois, and that is who we will continue to be moving forward. So thank you so much.
Thank you both for your leadership and your support. Thank you everyone for attending the press conference today. We are so excited to hear about the work that we're doing. And as you heard, even with a shortened session this year, we have a very ambitious agenda that we have to work together to advance. So we have important work to do together, standing in solidarity with our trans siblings in Texas and Florida and across the country as well. And we ask you to join our LGBTQ Advocacy Day at Equality Illinois on Wednesday, March 16th. Please go to the Equality Illinois website, equalityillinois.us, to register and find out more. That day we'll be taking actions together, contacting our legislators, hearing from impacted persons about the work that we're doing, and of course from our legislative champions. So please register today and make sure that you get all of your friends and family to register too. We can't do this important work without our partners like Dave and Carrie across the state, and our other partners in Peoria, in Springfield, and everywhere else across the state, and without our legislative champions. So we're grateful for your participation and for your advocacy and leadership.